All right, can you sit down on the chair? Is there any change?
It felt a little easier.
You walk to the door with a little more speed,
Yeah.
okay?
Let me get some
No,
cotton.
don't touch
Let me-
it,
let
don't
me get
touch
some
it.
cotton.
Oh, it's
We-
okay.
Yeah, she's got to wipe that up.
It's okay.
Let's see you get up. This is after Terry did your abdominal scar.
Wow.
Oh,
And you
wow.
didn't have to hold on to the, do you usually have to hold on to
No,
the arm?
I didn't this time, yeah.
Yeah, usually you do have to hold on to the
Okay.
arms, right?
Let's see you walk to the door.
Yeah, if you can do that on my ankles, where all the lack of nerve flow is, that's great.
And now come back.
When you do an injection of the ozone, can it help if you do two, or?
Depends on what your body
it
tells us.
depends.
Yeah.
Now, we both think, you think, and I think that you got up much easier,
It did.
quicker.
Yeah, I feel so, yeah.
And usually you
Okay.
have to put your arms on, your hands on the armrest.
Yeah, I'm pretty tired. The needles woke me up a little bit too, but
Yeah, then you didn't have to today, right now.
Okay, the
it's,
pain.
it's interesting. I feel more blood
Good,
moving now for some
Good.
reason, yeah.
good.
And the pain that's in your back, can you tell us what's happening there?
It's still there. I mean, it's always there, but
Any change?
I'll say it feels a little better. That's interesting. I've never heard of that before.
Good. So your back pain feels a little better?
Yeah.
What number, if 10 was the worst pain that you came in with, what is, what,
I know maybe it's probably down by a third.
great, to like
Great.
6.5 or so?
Yeah, I mean from what I came in with,
Yeah.
which is probably I'm living with a 4 to 6 generally.
You're living with a 4 to 6?
Yeah, all the time.
Okay,
I mean,
so maybe it's
yeah,
now.
I my knees, everything's in pain, and I'm just I've learned to block it out. That's what caused my high blood pressure and everything. I'm just
So it's down a third from
Yeah.
4 to 6.
yeah. I'm
Can
not,
you get up and walk to the door now? He couldn't do that
Yeah,
before.
much better.
He's getting better by the second, actually. Okay, let's have you sit down on the table, please.
Okay.
So let's have you walk to the door. And now come back to the chair. Okay, you can sit down.
Yeah, from when I came in, 50 to 60% less pain for sure.
Wonderful.
It's hard to, the mobility and it's affecting down here. It all comes from up here. With the sciatica, and I have the, above the tibular area here, where they meet, is where they do they put water in injections. It definitely helps my legs not in pain. I have what they call drop foot.
So the drop foot is why you're walking the way you are. You're swaying,
Yeah,
and that's because of the drop foot.
sciatica, both
Right.
legs. This one primarily is a lot of pain with the hip and everything. And I have a really good massage therapist. I trained her how to work on me. And so,
Oh, is this on YouTube?
yeah.
Thank you. What we want the viewer to see is the power of ozone and or neural therapy to reduce pain very, very quickly. And you're telling me at this point you've lost about 60% of your pain.
Yeah, right now I have. The neural therapy was kind of surprising because I have a scar, but that definitely.
Can I show that?
Yeah.
There's the scar, and we put a little bandage on it because of a tiny bleed from the needle, which is common.
Yeah.
So You have drop foot, and that's why you're swaying when you walk, and you have to pick your legs up really high.
Root neuropathy, drop foot,
Right.
sciatica,
And there's
lower back pain. It's
you're not here for us for that, and a drop foot would take months, many months, to try to work on. You're here for the pain in your lumbar spine. You just asked what to expect from the injection. You may continue to get better.
I hope so, yeah.
What happened is Terry hit the right spot. The fact that your pain is better means that the ozone was put into the spot that was needed, because your pain's better and there was a local anesthetic. But the local anesthetic wears off in minutes. It doesn't last very long.
Yeah.
It's only there long enough for us to do the ozone, and then another few minutes.
You don't think the local anesthetic would affect the back at all?
The local anesthetic could reduce the pain if it's in the right spot, and then the ozone continues the job, and it can continue to improve. And I'm going to call you in the morning to see how you've done before I do anything with this.
I'll be on the road.
Can you answer?
Yeah.
Okay. Thank you so much.
Thank you.
What did you just tell me about this fellow?
His pain went away 1/3 less after his neurotherapy, his
The scar.
his diverticulitis surgery scar and his umbilical hernia scar. So it went down 1/3, and then after his L2/3 facet and perifacet injections, it went down a total of 2/3, and now after half an hour PEMF with our super duper PEMF machine, it went down to almost gone.
What? Your pain is almost gone now?
Yeah, pretty much from these therapies right now, the pain is gone. I still have my root neuropathy thing, but as far as pain goes right now, I'm not feeling it. So that's really surprising. I was very surprised with the scar injections, the neurotherapy.
Yeah.
That did affect me.
That was a shock to you.
And yeah, I can't imagine a little thing into the scar there, but I've always felt that scar was ugly. It wasn't really, the surgeon didn't take any care.
Well, we're not going to blame the surgeon. I looked at that scar, and from my eye, I thought that scar looked like it was affecting you.
It was what?
It looked inflamed.
It looked inflamed. The scar looked like it was having a mean effect on your energy.
Well, I mean, surgeons for when they do it for looks, they can make no scar. They can make it like nothing, and if he would have taken his time, there wouldn't be so much scar tissue. You know.
That's a possibility. However, this woman just told you that back surgery has a 50% make you worse rate. And
It's not that high anymore. I did my research on
It's
that.
actually-
It used to be.
well, it's still a problem.
There's a percentage there. It's 50. Now that the procedures are very advanced, it's not quite that much anymore. I don't know.
But there's still a risk. You only had one treatment in this office. We would suggest that you consider getting more ozone therapy and PEMF to see if this pain can stay away and maybe you can avoid surgery. So that's up to you, sir.
Okay, I'll think about it. I'm very grateful for what's happened today and for my friends that offered to pay for this for me. I'm going to see how long it lasts. I mean, maybe.
Some people only need one treatment. Some people do need two now, so it's all hard.
Well, you
Hard
also
to predict.
realize, Terry, you used a short-acting local anesthetic. Procaine's gone in 15 minutes.
Oh, one more injection I did was into
A tooth.
Into a tooth. His tooth number 28,
Yes,
and that helped some too.
that may have helped a little bit
Right.
too.
He
But-
was walking easier after that.
But Procaine doesn't last very long, Robert. And
I know, yeah.
It's gone. So the results you're having now at this point are not the Procaine, the local anesthetic. It's ozone.
Will ozone last that long? Will it
It can
last?
last this long and longer. It
We're gonna put
can.
it to a test. I got to drive across country,
Okay.
which is crazy.
You'll let us know, okay?
I will. Thank you very
Thank
much.
you.
This is the pen machine he used.
Thank you, Terry. We like that pen machine. We think it's the best.
Yeah.